All right, everybody, welcome to this North American Spine Society webinar on nutrition considerations you need to know for spine disorders. My name is Ryan Tazel. I'm a physical therapist and chair of the exercise committee. The exercise committee is charged with providing educational materials for the public and clinicians to reduce the societal burden of pain-related problems through exercise. Nutrition is now a natural addition to our committee due to our interest in general and emerging evidence. The effects of nutrition on health are undeniable. However, the effects of nutrition on spine health is not well understood. So specific information is largely unavailable to assist spine care practitioners with clinical decision-making processes for implementation of nutritional approaches for their patients. Our aim with this webinar is to discuss nutritional considerations in spinal pain disorders. Our webinar moderator is Dr. John Mayer, whom I will just jump into introducing right now. Dr. John Mayer, our first presenter, his topic is General Introduction to Nutrition for Spine Care, State of Nutrition in Society, Practitioner's Scope of Practice, Interprofessional Considerations, Misconceptions, and Barriers. Dr. John Mayer is Director of Research and Innovation and Board of Directors member for U.S. Spine and Sport Foundation, a nonprofit organization established by Vert Mooney, MD, as the past president and founding member of NAS. Dr. Mayer is also the Chief Scientific Officer for Excelsior LLC and co-founder of Pillar of Health LLC. He obtained his Doctor of Chiropractic degree from the National University of Health Sciences and a PhD in Exercise Science Education from Syracuse University. He's a licensed chiropractic physician in the state of Virginia, a fellow of the American College of Sports Medicine, and a certified clinical research professional. He has over 20 years of clinical experience, program implementation, and research experience in occupational health, wellness and fitness, injury prevention, biomechanics and therapeutic exercise, and high-risk workers, tactical athletes, and first responders. He has been part of teams that have developed and implemented novel evidence-based clinical guidelines in musculoskeletal disorders. He is currently the principal investigator on a project to assess innovative strategies to manage low back pain in lower extremity amputees. He's the site principal investigator on a DoD-funded grant to assess management of low back pain in veterans and principal investigator of a U.S. Department of Homeland Security grant on back injury prevention in firefighters. He serves on the Scientific Secretariat for the Global Spine Care Initiative and is on the Scientific Advisory Board for World Spine Care. My goodness. John, Dr. Mayer, please take it away.
Thanks, Ryan. I appreciate the opportunity to participate in this. It's really groundbreaking to be able to present this information and get the feedback from the various spine care providers who are observing and listening in. So the purpose of my presentation is to provide some general concept about nutrition for spine care, and the following three presenters are experts in particular areas of nutrition and spine care, and they'll provide the meat of the presentation and recommendations for how spine care practitioners can implement the findings. So the overall course objectives for this entire course is to disseminate evidence regarding nutrition, provide knowledge to spine care providers, and enable the practitioners to apply the nutritional approaches that the panel experts will disseminate. So, presentation that I'm going to do for components, as Ryan discussed. The context of these four components is large, so I'm going to focus on particular areas to spawn responses and think and comments from the audience as we move forward. This is a groundbreaking concept. We don't have a good handle on nutrition for spine care, so my presentation, I hope, is more thought-provoking than anything. So, as a starting point, let's talk about obesity and its high prevalence in the U.S. and globally. You can see from this slide here that virtually every state, every person in these states are impacted one way or another by obesity. Some rates are higher at certain states, but across the board, there's only a few, and I believe this is 2016, that the current data, the yellow notation in Colorado and Hawaii are now exceeded, are now either orange or red. So high prevalence obesity by each state in the U.S., and this is a global phenomenon, not just U.S. You can see by the the rates increasing. It's been linear. Hopefully, we can get a handle on that at some point, but this is multifactorial. And why is this important for spine care? Well, obesity is linked to low back pain and other musculoskeletal disorders. There's a higher prevalence of back pain in those people who are obese, and vice versa. Those people who are obese have a high prevalence of back pain. What we're unclear about is the causal relationships. There's some data to support the relationship in one direction, and other data to support the other direction. Also, obesity for those with back pain impacts their muscular capacity and functional capacity, and those that are obese have higher rates of back injury, increased costs, and increased absenteeism for those that work with back pain and obesity. And further, those that are obese, the prognosis that their disability will be worse is also increased. What we're unclear about at this point in time is if you are able to reduce obesity in individuals and population through nutritional interventions, what is the impact on low back pain? To my knowledge, there's not a solid clinical trial on this topic with reducing obesity or any other nutritional approach specifically for back pain or other spinal disorders. We need some high-quality clinical trials on this topic. So what do we know about dietary guidance? What has been purported? What is commonplace? Now, I'm going to start with what the U.S. government says. It has made some announcements or guidelines on diet in particular. And 60 years ago or so, the 4 basic food groups, 1992, the original food pyramid, 2005, the new food pyramid, and currently it's myplate.gov. So this particular slide here shows the 4 basic food groups: milk, meat, fruits, vegetables, and grains. And then we moved on to the pyramid. As you know, at the base of this pyramid, grains, bread, pasta. So back in 1992, the advice was that should be the staple of your diet is grains, pasta, and rice, etc. And this is proportional too. So the pyramid is designed about how much of your calories you should intake from these particular food groups. And note here, fats, oils, and sweets, it says, but fats and oils used sparingly. And I think our presenters will talk about a different approach in a few minutes. And those of us who experience at this point in time trying to do this type of diet, focusing on grains and very minimal fat, probably all have some interesting experience with that, from maybe getting more obese, gaining weight, but other types of problems that you would observe. And my personal experience right around this time, tried this to a T: grains, minimal fat, minimal protein. And I had all sorts of problems with my skin and eczema and sleep problems and such. So unsure if that was worthwhile. Then more recently, my pyramid, 2005. It's sort of a pyramid, but I'm not quite sure what it is. And currently we have the myplate.gov. And the plate is not intended to be the proportions of the food. It's not intended to do that. However, they do provide some personalized daily food planning based on your age, sex, height, and weight, and your physical activity level. I presented this myplate.gov in a class activity with a doctor of physical therapy students 3-4 years in a row, and asked the students to go ahead, put in your personalized food plan, and see what myplate.gov gives you. And I asked 2 questions. Do you think this is useful for you and would be a diet you would follow? And I also asked for your patients, and particularly those with back and neck pain, would you provide this as a recommended type of diet or nutrition approach? And in both cases, the answer is resounding no. So no, they wouldn't do that. In particular, the majority said it's too many calories and I would never eat that much carbohydrate, and absolutely not for the spine care patients. One, based on what myplate.gov types of food choices they recommend, and also because the system appears to be too cumbersome for patients to be able to use. So what type of spine care provider can a patient seek for nutritional guidance? Here's a partial list of some of the main providers: physicians, chiropractors,